Hello and welcome. We're in week 8 already, and this week we're going to talk about privacy and security. Now, of course, you all know that medical records or professional medical coding specialists work within the HIM department that stands for Health Information Management. Sometimes called health informatics. And it's very important because one of the things that the HIM department is responsible for is to collect data about the patients, about the facility, and to store and protect that data so that only those who are authorized can possibly see it. And then we also analyze that data so that we can provide insights into what's going on within the facility, between facilities. And of course, we share data with the Joint Commission and the Centers for Medicare and Medicaid Services so that that can go deeper into research. So what we do is very, very important. And there are one primary law with two very important sections, HIPAA's privacy rule and HIPAA's security rule. So let's talk about HIPAA's privacy rule first. This is probably what you're most familiar with. And this established privacy standards in the United States. It was passed in 1996. However, it was not implemented until 2003. That gave all of the healthcare facilities in the United States 7 years to get their act together so that they could comply with this rule about protecting patient information. This extends, now you're probably very familiar with the physician-patient confidentiality. That has been around since Hippocrates in what, year 200 or something like that. I wasn't a history major, what can I tell you? But it has always been that patient-physician communication is held private, and that is so strong that you may know from watching television or the movies that a physician cannot even be called upon to testify about this privileged information in court under no circumstances. Well, not no circumstances, but very rarely can the physician-patient confidentiality be broken. So what HIPAA's privacy rule does is it extends that patient-physician confidentiality and extends that protection to everyone in the physician's workplace, okay? And everyone involved in caring for that one patient. So now it's not only physician-patient confidentiality, it's physician, nurse, medical billing specialist, medical coding specialist, lab personnel, and everybody else, including the health insurance company that is responsible for caring for that patient. Now, everybody is locked into that confidentiality, protecting the patient's privacy, so that any individual can feel comfortable in telling the most embarrassing things to their physician and not having to worry about being documented in the patient record, because only the people who are legally allowed to see the patient's record, like the nurses and the medical coding specialist and the health insurance company, all of those people are covered entities under HIPAA's privacy rule. So everyone is now federally, legally obligated to protect that patient's information. Okay. And this is a federal rule, which means it applies to everyone within the United States. No ifs, ands, or buts, no exceptions. Very important. Okay, so the privacy rule identifies this patient information as PHI, and that stands for protected health information. And what is in this category is everything the patient could possibly tell the doctor, past information, present information, and of course, future would be maybe a family history of something, or it might be, and this would include the physician's observations and assessments. Okay. Physical and mental health conditions, everything, the whole body from the top to your toes. Okay. All protected, past, present, future, top to bottom. That's it. Ain't nothing else, right? Right. Okay. Documentation of the provision of healthcare services, procedures, and treatments. Of course, every time the doctor does something to or for the patient, it must be documented. You know this already because you have been learning or will be learning about not only coding with ICD-10-CM, the past, present, and future conditions, diagnoses, right? Signs and symptoms. But you also will have to code using CPT or ICD-10 PCS if the patient is in the hospital to identify every service, every procedure, every treatment provided to that patient. And why is this protected? Because we can tell due to the rules of the standard of care, also known as medical necessity. There has to be a medical necessity to provide a service or a treatment or a procedure. So the two go together. Always. Okay. And then just to make sure we're complete, past, present, and future payment for the provision of health care, because again, money. Ooh, money. No, okay, it's private. Okay. All right. So basically, whatever it is, I call this the keep your mouth shut rule. Okay. Don't talk about other people's business that you learn about when you're on the job. Just, okay. All right. Now, the other part of HIPAA, which of course is a federal law, which means it's big and it includes a million other things, is HIPAA security rule. And this is the federal law that requires the facility to protect that PHI, all of that information. We not only have to collect it and store it, we have to protect it from the eyes of people who have no business seeing it. Okay. And HIPAA security rule breaks this down into these safeguards to ensure confidentiality, integrity, and security of the information. So administrative safeguards, physical safeguards, technical safeguards. And you can read about this in the HIPAA security rule summary that I posted in the course room. It's really pretty straightforward, but the administrative safeguards have to do with HIM's responsibility for making sure that only those who have professional reasons for seeing this information can see this information. This includes the assignment of passwords. It also includes the deletion of passwords when somebody gets fired or quits or leaves, okay? This also includes the training, the responsibility of the Health Information Management Department to train everyone else in the facility on HIPAA's privacy rule and the security rule. Physical safeguards sound exactly like they are. So that's the lock on the door to the HIM department or a guard at the door. That is using, in addition to passwords, possibly, no, that would be technical. So physical safeguards are the lock on the door, screen protectors on the computer so someone cannot look over someone's shoulder and read what information is on their screen and things like that. Okay, and then technical safeguards would include using biometrics. Now, biometrics is, I'm sure you all know this, right, is using your fingerprint or your face to open your phone, right? That's biometrics. Bio is your physical nature. So using a fingerprint or a retina scan or face identification, in addition to a password and username, of course, and things like that. So these are very important things because, yes, confidentiality, we have to protect this information so that nobody else can just come along and see it. And if you want a really good example of this, it's a while ago, but I don't know, maybe 10 years ago, George Clooney, you know, the actor, the very handsome actor. Yes. Okay. George Clooney, the actor, was in New Jersey and he was riding a motorcycle and he was in an accident and he was taken to the hospital emergency room to be treated. Well, as a result of the HIM department doing their job and protecting George Clooney's information, the system, the electronic health system, actually tracks every person who logs in and looks at any patient record. So the HIM department was able to identify 24 employees of the hospital who use their username and password or whatever to view Mr. Clooney's private protected health information, and they were either suspended or fired. That is the system working properly. Just because George Clooney is a celebrity does not mean that he's not entitled to his privacy. He is a human being, he is a person, and most importantly, the minute he crossed the threshold of that hospital, he was a patient. This is federal law. This applies to everyone. Okay. Now, before we mention protecting confidentiality, which is keeping private what the patient wants private, but we also talked about the integrity of the data. And this is to make sure that the electronic health record is protected so that what the physician writes stays and is accurate. Okay. Now, I know weeks ago we talked about querying the physician when something looks off, when something is ambiguous or contradictory or something like that. But we also have to make sure that nobody can go in and arbitrarily change information in the patient's record. And that is to ensure the data has integrity. And this is important because the data, the information, is used not only to identify and track patients as they move through the facility, make sure the right patient gets the right medication at the right time in the right dose. Okay, make sure that the right patient gets the right diet from the kitchen. Okay, and make sure that they only get billed for what they have and they only get diagnosed and reported on the claim forms, right? But it's also Important because the patient record is the foundation for continuity of care. Now, that means, and especially in a hospital, where there might be a group, a physician group, so the same doctor doesn't see the same patient day after day after day. And then you also have different specialties. And like I said, you have the kitchen to make sure the patient gets the right food. And the nurses need to make sure they're giving the correct patient the correct medication. And all of that has to do with the integrity of the data that is in the patient record. All of that has to do with, we have to make sure that what is being read in this patient record is accurate and true for this patient. Otherwise, very serious things can happen to a patient. Wrong medication, wrong food. They could be given a food that they're allergic to. Whatever the point is that part of our job in the HIM department is to protect data integrity. And that also is supported by our armed forces, which is HIPAA security rule. And it's our responsibility to make sure that these safeguards are in place and being used. All right, so we need to make certain that the data is protected. And one of the things that is used for that is the same as the George Clooney story, okay? Because if unauthorized people can log in and look at his medical record, some of those people might actually be able to or want to go in and change information in the medical record. And that, again, can result in big problems, not only health threats, interference in continuity of care, but it also can make the patient vulnerable to a scam, misconduct, inadequate treatment, data theft. If something personal was happening with Mr. Clooney, he could be blackmailed. Said, I know about your blood work and you know, whatever it is, it's our job to prevent that from happening. It's our job to protect this information so the patient can feel comfortable in telling the doctor their most embarrassing or most intimate secrets so the doctor can properly care for them. And that's hard enough, don't you think? Yeah, we don't need to be thinking about it getting on the 6 o'clock news or to our mother-in-law or whatever. Okay. All right. So in chapter 8, you're going to read privacy, security, and fraud. It will include information about HIPAA as well as the False Claims Act. And I think we already discussed that in a previous session. But if you have any questions, you know, you're going to email me, right? Right. Okay. Do your chapter 8 homework after you read the chapter. And I think you have the privacy rule summary. That is a great, it's something like 10 pages. It's an excellent summary of the privacy rule. And I strongly suggest you download it and keep it for your future reference. And if the security rule summary isn't there, I'll see if I can add it now. Okay, because that also, if not, you can Google. All right. So, you know, I am here to support you. Absolutely. If you don't kind of sort of understand something, email me. We can email back and forth. We can set up an appointment to talk on the phone. I know how to talk on the phone. Or we could set up an appointment to do a one-on-one Zoom, a FaceTime. We can Skype, whatever works for you. I am technologically flexible. Okay. So remember, part of all of this is your responsibility as a professional medical coding specialist. How fantastic. See ya.